First tonight, Governor Gina Raimondo warning Rhode Islanders that a few bad decisions could lead to detours on the road to reopening. I'm Shannon Heggie. The governor says Rhode Island remains on track to enter phase 3 next week, but she pointed to the rising cases in states in the South and West as examples of what can happen if people get too complacent. Rhode Island's positivity rate remains at about 2%, but the Department of Health reports another 6 people with the virus have unfortunately died. The number of people in the hospital has gone down by 1. The governor had a lot to say at her briefing today. Let's get to Eyewitness News reporter Kim Kalunian live at the State House. Kim?
Well, Shannon, good evening. That's right. The governor had a lot to say today. New guidance for trips to the beach and also about summer sports. But folks who watched her briefing this afternoon might have noticed that she struck a little bit of a different tone. One that was reminiscent of the early days of the pandemic here in Rhode Island, days that the governor says she does not want to go back to.
This is about science. This isn't about politics.
Governor Gina Raimondo striking a stern tone.
If we get complacent, we're going to be back in a mess. We're going to be right back where we were when we started this.
On Wednesday, a warning to Rhode Islanders. If they don't follow the rules intended to slow the spread of coronavirus, we could end up like other states, seeing a major uptick in cases.
I get angry when I see people, like Kim was just saying, routinely violating the rules.
Still, the governor says the state is moving forward on its road to reopening. At nursing homes, residents can now have communal meals and activities, though outside visitation is still not allowed, but is in the works. Also starting this weekend, state beach parking lots will increase capacity to 75%, and there will be a new tool to check the status of beach lots online before driving there. The governor says she doesn't believe this will increase the number of people on the sand, but thinks it will cut down on illegal parking.
And I'm a little nervous about this. So we're going to watch it every weekend, and if we start to see large crowds, we're going to have to go back to some form of restriction.
Raimondo also announcing youth and adult games for no or low contact sports can occur in phase 3 between stable groups. This applies to teams from within Rhode Island and other states that have no stay-at-home orders or travel restrictions in place. A limited number of spectators can attend if they're wearing masks.
And those new guidelines for sports will be posted to the Reopening RI website on Monday. Again, those will go into effect during phase 3. We still don't know the exact start date of phase 3, but the governor says she hopes to announce that date on Monday. Live at the State House, I'm Kim Kalunian, Eyewitness News.
Just in, Governor Gina Raimondo has signed the supplemental budget approved by the General Assembly last week to address the revenue shortfall caused by the pandemic. Meanwhile, the governor says the state remains on track to enter phase 3 of reopening next week, but is also warning people against letting their guard down, saying she's seeing signs of people getting complacent. Also today, the governor announced they will be winding down the rapid COVID-19 testing site that CVS set up at Twin River. Eyewitness News reporter Kim Kalunian joins us live from the State House now with what this means for the state's testing capacity. Kim?
Yeah, Shannon, lots of news coming out of today's briefing, including, as you just mentioned, the closure of that Twin River testing site, which was done in conjunction with CVS Pharmacy. There they conducted a rapid form of COVID-19 testing. And as we've told you before, a panel of experts advised the state to phase out its use of that rapid test because it gave a false negative result about 20% of the time. And while the state says they will be closing that facility, they also still plan to use that rapid test in other settings. So I asked why.
I want to say one thing quickly to Kim, because you raised a good point. We have to use the technology that's available. And each technology plays its own role as we deal with this crisis. If you're in a situation we are trying to rapidly identify as many positive cases as you can, there's a role for this Abbott ID device. So if you have an outbreak at the ACI, if you have an outbreak in a manufacturing operation, whatever, in a community, and you want it to quickly find positives, there's a role for it. And with the Abbott machines at CVS, we found thousands and thousands of positives and quickly and got them into isolation so they didn't spread it. So it is true, as you say, that it's not the best-in-class, gold standard, most accurate. But if you're in the business of quickly finding positives and putting them in isolation, there's a role in a toolkit. It's a tool in the toolkit that we're going to continue to use.
We're supporting hospitals to be able to have the Abbott ID Now instrument, and certain mostly healthcare related settings to be able to use the machine, but then also have the healthcare provider support so that if someone tests negative but clinically and epidemiologically has symptoms of concern, we can do something different. So that's also part of this process.
Now, CVS testing sites do still exist at 10 different locations across the state, but they do not utilize that rapid form of testing. For a list of those locations, you can head to our website, WPRI.com. Live at the State House, I'm Kim Kalunian, Eyewitness News.